Right, it's 10:01, so I'm going to go ahead and get started. So hello everyone, my name is Lindsay Bondyke and I'm a program specialist within the Behavioral Health Benefits Coverage Unit with Nevada Medicaid. Thank you all for attending today's public workshop. And as a reminder, this workshop is being recorded and the slide decks and policy drafts are posted on Medicaid's Public Notices webpage. And I did go ahead and put a link to the page in the chat for your reference if you want to check that out. So today I'll be discussing revisions to Medicaid Services Manual, MSM, Chapter 400, Mental Health Services, and Chapter 4500, Behavioral Health Training Clinic. Right, so I'll begin by reviewing the revisions made to Chapter 4500, and then I'll review revisions made to Chapter 400. There'll be time for public comment after each review. So to start us off, I'm going to go ahead and pull up Chapter 4500 to walk through those changes with you all. So I'm going to stop sharing and switch over to the policy draft. All right. Okay, so displayed on the screen is MSM Chapter 4500, Behavioral Health Training Clinic, starting with Section 4502.5, Covered Services. Under the non-medical service bundle, we added neuropsychological, psychological, and developmental testing as a covered service. We also combined individual, group, and family therapy to one line. Under the medical services bundle, we replaced the language non-medical service listed above with a list of specific services covered under this bundle. These services include behavioral health assessments with medical services and psychotherapy with evaluation and management services. The goal of this change is to provide increased clarification of the medical services covered under this model. Scrolling down. Okay, so moving to section 4502.6, non-covered services. We added supervision, education, and training provided to the trainees as a non-covered service. This change is a result of communication with our federal CMS partners. Supervision, education, and training will still be a part of the clinic model. However, it will not be considered a Medicaid covered service. This change is reflected in the billing section below, section 4502.8. Here we removed language stating that supervision, education, and training are included services with both service codes. And this concludes proposed changes to Chapter 4500. The proposed effective date of these changes is August 26, 2026. And as a note, the state plan amendment for the service is still pending federal approval. I'll go ahead and pause here for public comment on these revisions. Do we have any questions or comments about any of these changes? And you can feel free to raise your hand or put a question in the chat. Not seeing any questions. No, okay. I'll go ahead and move over to MSM Chapter 400 then. All right, okay. So now switching over to MSM Chapter 400, Mental Health Services. I'm going to walk through the changes with you all. And just as a note before I begin, there are quite a bit of changes being made to this chapter. However, the majority of the changes are just intended to improve clarity through cleanup and reorganization, and they don't alter service delivery. So we'll begin at the start of the chapter with Section 403.1, Outpatient Service Delivery Models. Section 403.1b, the word licensed was added before clinical social workers and marriage and family therapists to align with language found within the rest of the chapter. Section 403.1c, qualified mental health professional, or QMHP, was replaced with licensed professional. As of February 2026, QMHPs are limited to clinical interns only. So to align policy with this change, references to QMHPs have been replaced with licensed professionals where appropriate. In sections where the policy applies to both licensed professionals and QMHPs, both terms are included. I will only show this example during my presentation, but this change has been made throughout the whole chapter. Okay, moving underneath provider standards, section 403.2A9, Division of Nevada Medicaid was changed to Nevada Medicaid. Section 403.2B, 1, 3, and 4 were removed. This includes requirements for behavioral health providers to have written policies and procedures for both their services and clinical supervision, as well as ensuring access to psychiatric services. These requirements are not monitored by Medicaid and therefore are being removed from policy. In the next requirement at the top here, we replaced care coordination with transitions of care and added that the transitions of care and discharge planning should be based on the recipient's treatment plan and provided when applicable. Moving underneath supervision standards, section 403.2A1, we replaced the list of types of licensed professionals with the word licensed professional for simplicity. We also removed the words including interns after QMHPs, as QMHPs are interns only now. Section 403.2A, 1A, we replaced 30 days with 90 days for the requirement of an up-to-date case record. This change was made to align with the policy requirement of 90-day reevaluations for treatment plans. Section 403.2A, sorry, if you could please mute, that would be great. Thank you very much. Section 403.2A, 1G, I apologize. Moving back up, sorry. Section 403.2A, 1G, and H were removed. G states that providers must operate within their scope, and H states that services are provided in a safe and efficient manner. These requirements were removed to eliminate duplication within the chapter. Section 403.2A, 1G, we remove the list of activities and requirements for the meetings between direct supervisors and clinical supervisors. The documentation for these meetings is not monitored by Medicaid and therefore is being removed from policy. The requirements will be left to the supervisors' licensing boards. Moving underneath the documentation, section 403.2B, 2C was removed. This section states that all involved professionals must incorporate a treatment plan that best serves the recipient. These requirements were removed to eliminate duplication within the chapter. Okay. Section 403.2B, 3A, 4 through 6 were combined into one line as they all discuss requirements for SED and SMI determinations. The words when applicable were added. Section 403.2B, 3C2. For the scope of services, the word daily was removed as not all recipients will require daily services. Section 403.2B, 3C5. For care coordination, the word treatment was added before the word plan for specificity. The words when applicable were added here and also in number 7 down here below as well. Okay, section 403.2B, 3D4. For the discharge plan, the word aftercare was replaced with transitions of care, and the words when applicable were added. Section 403.2B, 4A1. Language is added to state that the clinical supervisor's signature is only required when the rendering provider is a QMHP. Now moving to provider qualifications, section 403.3. The language added here at the top of the section was previously included under each provider type listed below. So to limit repetition, this information was moved to the top and applies to all behavioral health providers defined within this section. And this is just an organizational change. So you can see here, I'll scroll down to show the whole section that was added. Section 403.3C2, we have removed information regarding qualified behavioral health aides or QBAs functioning as peers. Certified peers must now enroll in provider type 97 or 93 only. Please keep an eye out for future web announcements regarding this change. Section 403.3C2B, 1 through 3. Under the initial competency training requirements for QBAs, the word original was added before signature. This requirement aligns with the in-service training signature requirement for QBAs, which is listed in this section below. Section 403.3 C4C. Once again, information regarding QBAs functioning as peer providers was removed. And then this next section here, this next bit of policy that has been removed is the information that we moved to the top of the provider qualification section that I showed just a minute ago. It has been removed from under each provider type description, and I wanted to show that here, and this was done in the same fashion under the other provider types below. So you can see all that was removed. Section 403.3, D, 2, and 4, under Qualified Mental Health Associate or QMHA qualifications, The words or higher were added after the words bachelor's degree. This clarifies that individuals with a higher level of education are allowed to enroll as a QMHA. This is not a new change and was previously allowed, but the goal was to clarify language in policy. Section 403.3 D, B, 1 through 3. Similar to the changes made for QBAs above, under the QMHA training requirements, the word original was added before signature. This requirement aligns with the in-service training signature requirement for QMHAs, which is listed below. Section 403.3 C1. Under the qualifications for QMHPs, the list of licensed professionals was removed. Licensed professionals no longer qualify as QMHPs and therefore have been moved into their own section, which I will display shortly. The removed language has been replaced with a list of qualifying interns who can enroll as QMHPs. The list of interns was previously included under this section but was moved up for reorganization. So you can see here's where the new intern section has been added and moved up. Section 403.3 C2, the Early Childhood Service Intensity Instrument, or ESSI, was added to the list of assessment tools. Also in this section and throughout the rest of the chapter, the Child and Adolescent Service Intensity Instrument, or CASI assessment tool, has been replaced with the Child and Adolescent Level of Care / Service Intensity Utilization System, or CalLocus CASI tool. This change is to align with the unified tool developed by the American Academy of Child and Adolescent Psychiatry. Section 403.3 C3, the information calling out clinical interns specifically was removed as QMHPs are interns only now. Section 403.3D, information for psychological assistants, interns, and trainees was moved into its own section and revised for clarity. The qualifications for these providers were not changed. However, repetitive information was removed for clarity and information regarding billing at a federally qualified health center or FQHC was added. I will show you in just a second the original section which was removed. All right, section 403.3E, a new licensed professional section was added. This list of professionals was removed from under the QMHP section and moved into its own section here. Section 403.3D, this is the section that previously described information for psychologists, which was removed, revised, and moved above in the section above. Section 403.4, Managed Care Members. This section discusses information for managed care members and applies to all outpatient and rehabilitative mental health services listed in this chapter. Section 403.5, Outpatient Mental Health Services. Here we added coordinated specialty care to the list of therapeutic interventions. Section 403.5 A4A, under the billing section for assessments and screenings, the code 90792, which is a psychiatric diagnostic evaluation with medical services, was added. This code was already available to medical behavioral health providers. It was simply omitted when the billing grid was originally added to policy, so it's being added now. And additionally, the prior authorization language, which used to live below the grid here, has been moved up to this paragraph here for reorganization. Now moving to partial hospitalization programs, or PHP, section 403.5 D1, language has been revised within the PHP description. The newly added language reads, these services are furnished under a medical model in an outpatient setting where the PHP provider assumes clinical liability while a recipient is receiving PHP services. An affiliation between the PHP provider and hospital or FQHC must be a documented agreement that issues omitting privileges to promote continuity of care for recipients who require hospitalization. An FQHC that is certified and enrolled as a PHP provider is not required to have an agreement with a hospital. This language is being updated to align with language in Medicaid State Plan and other MSM chapters. Section 403.5 D1A, an enrollment criteria section has been added. This section clarifies information that must be included in the PHP description, which is submitted upon enrollment and with each prior authorization request. This information is now listed on the PT14 group enrollment checklist as well. And then for these next few sections, I'll just quickly run through them as we just changed the titles to align with the rest of the titles throughout the MSM for consistency. So here we have replaced scope of services with covered services. Now this is titled Authorization Requirements, Utilization Management, and Eligible Providers. Moving to Intensive Outpatient Program, or IOP, Section 403.5 D1A, an enrollment criteria section was added for IOPs as well. Similar to PHP, this information is now available on the PT14 group enrollment checklist as well. And once again, the following sections have just been retitled for consistency. So we have covered services, authorization requirements, utilization management, and eligible providers. Within the utilization management section, the first paragraph was removed as this discusses the enrollment requirements for IOP, which are now listed in the enrollment criteria section as shown above. Moving under coordinated specialty care, section 403.5 D3A1, language was added to state that a function of the program is to build previously undeveloped skills needed to be successful with employment and education. Section 403.5 D3B1, language was added to state that the providers listed in the eligible providers section under this model are required to be a part of the coordinated specialty care team. Section 403.5 D3B2, the information requiring the group to obtain a unique and separate NPI for enrollment was removed. This requirement will apply to all Medicaid provider types and will instead live in MSM Chapter 100. Section 403.5 D3G. In the draft that was posted for this workshop, we updated the encounter limits for coordinated specialty care services. However, we've decided to remove this update for now as conversations with CMS regarding the service are still ongoing and we don't want to make premature changes. So this change will not be a part of the proposed updates that are taken to public hearing. Section 403.5 D3H. This section, which discusses information for managed care members, has been removed. A separate section that will apply to all OMH and RMH services has been added toward the top of the chapter and was previously shown in this presentation. Moving to medication training and support, section 403.5 D4, the servicing providers have been removed from the initial service description paragraph and moved into a newly created eligible providers section as shown here. The eligible providers for the service include qualified medical professionals and Medicaid enrolled RNs when billed with the appropriate modifier. And now moving to rehabilitative mental health services. Under basic skills training, section 403.6 C2, the eligible providers section has been renamed and revised. The revisions include adding licensed professional language where appropriate. Similarly, under psychosocial rehabilitation, section 403.6 F2, the eligible provider section has been renamed and revised for clarity. And then finally, in attachment B, B4, an outdated link for CMS regulations and guidance has been replaced with the correct working link. And this concludes the proposed revisions to MSM Chapter 400. The proposed effective date is August 26, 2026. And I'm going to go ahead and switch back to my slide deck now. Stop sharing. All right. Okay. Now moving to public comment on MSM Chapter 400. Do we have any questions or comments at this time? You can feel free to raise your hand or unmute yourself. Not seeing any questions in the chat either. Okay, I'll go ahead and put up the, here's the behavioral health inbox email. So if any questions do come up, feel free to email us. But thank you all for attending this public workshop. I appreciate you spending the morning with me. Thank you, everybody.
Thank you.
Thank you.